Hello, everyone, and welcome. The U.S. Centers for Disease Control and Prevention, Office of the Associate Director for Policy, is pleased to present this introductory webinar series on thinking in systems. My name is James Cope. I'm a health scientist with the Office of the Associate Director for Policy, and I'm serving as host for this webinar series. For any questions following this presentation, please contact us at the following email address, healthpolicynews@cdc.gov. Our guest facilitator today is Steve Peterson, who has a deep experience applying the thinking in systems approach in a broad range of teaching, research, and consulting settings. With that, I would like to introduce Steve and thank him for being here today.
Hello, and welcome to the second in a set of 3 webinars in which you will be introduced to the thinking in systems approach. This webinar is titled Conversation Starters. In this session, you'll learn about some simple behavioral and structural approaches that will help you to use the thinking in systems approach in your own work. I'm Steve Peterson, and I'll be leading these webinars. I've been a practitioner of this stuff for over 35 years, and my aim in leading these webinars is to help you develop your skills so that you can use the thinking in systems approach to gain insight into public health issues and improve public health outcomes. Let's get started. It's important to start with a few acknowledgments and disclaimers. I'm the primary developer of the content that you'll see in these webinars. When I draw from work done from others, I'll acknowledge that effort on the relevant slide. And it's important to note that the funding for this webinar was made possible by the Centers for Disease Control and Prevention and Chains Lab Solutions under the cooperative agreement that you see here. The findings and conclusions of this presentation are those of the authors and do not necessarily represent the official position of the Centers for Disease Control and Prevention. Before we dig into the content, I'd like to give you a bit of an overview, both of the series and of this particular webinar. One way to clarify what we're aiming to do in this series is to start with purpose. What are we trying to do here? The purpose of these sessions is straightforward. We're aiming to use these 3 webinars to help you build your skills in using what I'm calling the thinking in systems approach. This approach has been around for a long time. We recently celebrated the 60th anniversary of the founding of System Dynamics, which provides the analytical underpinnings for the approach, and it has great value in supporting productive thinking about public health issues. In the previous webinar, we focused on some of the fundamental components of the toolset. You learned about the thinking in systems process, and you gained a bit of practice in using the supporting skill set. Central to that skill set is the use of stocks and flows to represent the underlying structure of a dynamic process, and then using the map that you create to think about how a problem behavior evolves over time. If you're watching the recording of this webinar and haven't yet spent time with the first webinar, I'd encourage you to do so now. These webinars build on one another, and we'll be building on the skills developed in the previous webinar during this session. In this session, we'll be focusing on a set of approaches that I've found to be very helpful as conversation starters. These conversation starters can help you to gain traction in thinking physically and operationally about public health issues. In my experience, these approaches are effective whether you're working on your own or in a group setting. In the third session, we'll be focusing on a set of real-world examples that use the thinking in systems approach to gain some insight into challenging public health issues. You'll hear from folks in the trenches about what's been done and how the approach is stimulating development of policy responses. Our intent is to be as hands-on as possible. And if previous experience in workshops is to be a guide, and I've run a lot over the years, these sessions are likely to be pretty intense as you work with what may be new concepts and ideas. Today, for example, you may feel a bit like you're taking a drink from a fire hydrant. This stuff is like many other topics. You can learn about thinking in systems by listening, but your learning journey may not take you very far. To learn to think in systems, you really need to engage in the process of building stock flow maps and then relating these to the dynamics of a policy issue. Given the constraints of the webinar approach, this may be a challenge. One way for you to overcome that challenge is to work with me. So take a couple of minutes now and get out a pad of paper and a couple of sharp pencils. You'll need them. This presentation will also use several public health examples to illustrate key concepts of thinking in systems. But keep in mind that these are just examples for teaching purposes, and the concepts are generalizable to any topic of interest. Today's agenda, it's pretty straightforward. We'll start with a very quick review of the thinking in systems approach. This will help you to scrape any rust from your brain cells that may have accumulated since you worked through the first webinar. Then we'll walk through two sets of conversation starters. The first of these is behavioral in focus, and you've seen it before. The second set is structural in focus. We'll walk through 4 very simple stock flow main chains, showing a few examples along the way. Then we'll go through a simplified but real example that uses conversation starters to generate insight. To wrap up, I'll offer a few quick thoughts. Okay, let's do a quick review, and let's tee up an important challenge that you're likely to face as you develop your thinking and systems skills. Let's start with the why question. Why consider the thinking in systems approach? I like to think about systems problems as having some important and common characteristics. Among them, dynamics in the sense that they involve change over time. They're driven by multiple interdependent players with diverse interests. These interdependencies cross multiple boundaries: geographic across communities, functional within an organization or a community, and areas of expertise when you want to understand what's going on. Because of the dynamic complexity involved, it can be very, very difficult to communicate the essence of what is causing systems problems, and extremely difficult to engage productive communication around effective policy responses. Now, if you think about the big and many of the smaller problems in public health, it seems clear that they fit into this class that I'm calling systems problems. Remember the list that we generated in the last webinar? It had topics including youth violence, opioid abuse, Zika virus, and growing resistance to antibiotics. These problems are pervasive. You don't need to look very far to find a systems problem. They're tough nuts to crack. They're difficult to understand and difficult to sustainably resolve. We need tools that can help us to appropriately frame issues as systems issues, to see the systems nature of the issues. We need tools that can support rigorous thinking about how the structure of a system, how it's put together, can give rise to the dynamics that we're seeing, while productively bringing together and synthesizing multiple perspectives and disciplines. My experience over the past 30 years in working with this stuff is that the thinking and systems approach has great potential to help in framing issues, thinking about dynamics, and facilitating stakeholder engagement. In the first webinar, I walked through a very simple example that used this approach to provide a sense for this potential. We also talked about the what question. There are multiple different definitions of systems thinking. You might try doing a search on the phrase, and you'll be amazed at the diversity of views. Here's how I tend to think about it. Thinking in systems is a design-focused process that consists of 3 major stages: sharpening the focus, developing a map, and testing the thinking. These stages reinforce one another. Throughout, you're working to interact with stakeholders to advance the thinking. A practical skill set supports the process. Essential best practices within this skill set include dynamic thinking, operational thinking, expanding the boundary of inquiry, feedback thinking, and evidence-based action taking. While there are many permutations, as you'll see if you dig into the search results on the phrase systems thinking, people who are effective in thinking in systems tend to use a process like the one outlined here, and they tend to use the skill set outlined here to gain insight. For the how question, we talked in the first webinar about the importance of learning by doing. Even if you have a day job, you can build your skills in thinking in systems by practicing low-impact aerobics, by being cognizant of boundaries, and by working to expand them just a bit, and by sharing your thinking with others. Did you practice any of these activities since the first webinar? If yes, Congratulations. If no, then I'd encourage you to take a minute now and write down one or more activities that you'll pursue in the coming days. I'll wait here till you get back. Okay, good. Now, here's a real challenge. How do I get started in creating these maps, either on my own or in a group setting? Things like low-impact aerobics are great ways to develop baseline skills, but taking the first step in applying your skills to a specific issue area can be challenging. How do I get started? My experience is that while a sophisticated map is often a great place to end the process, it is pretty much always the case that you want to start simply. And in fact, simple stock and flow maps can often have greater utility than the more sophisticated and detailed maps. So how do you go from a blank sheet of paper and maybe some not so well formulated ideas around a problem to a map that can enrich and advance the thinking and can engage relevant stakeholders? There are very few guarantees in life, but the sets of conversation starters that I'll outline here can be productive. You've got a glimpse of these before. The first set of conversation starters is behavioral in focus, behavior over time, or bot graphs. The second set of conversation starters is structural in focus. Main chains are configurations that dynamically distribute or allocate stuff among a set of stocks. We'll be considering 4 basic types today. Let's take a look. We'll start with behavior over time, or bot graphs. If you saw the first webinar, you'll remember these. They're important focusing mechanisms, so we'll take another look here. As shown on the figure on this slide, bot graphs show one or more key performance indicators displayed as behavior over time. Time in minutes, hours, days, weeks, etc., is on the horizontal axis. The performance indicator that reflects the issues of interest is on the vertical axis. A bot graph can help you in at least 3 ways. First, it can help you to broaden your perspective by enlarging the temporal boundary around an issue. You can consider today's event in the context of how you got to where you are and how you'll get to where you want to go. Second, it can help you to put a stake in the ground around data. It's really fantastic, although sometimes challenging to the ego, when you draw a bot graph and then you find that your graph differs in some substantive way from actual data. The discrepancy between the two provides you with an opportunity to learn something. Finally, a bot graph can help you to create hypotheses. If you see a graph that, for example, changes direction as shown here, you have a strong incentive from the graph itself to explain this dynamic. Then, once you've created a map, you can use that map to help test your thinking through reasoning, through mental simulation, and perhaps through more formal computer simulation. Creating a bot graph can be kind of tricky. Here's a checklist of sorts that you might want to keep in mind as you're developing bot graphs. I know that the list is long and perhaps a bit imposing, but this is a bit like learning to ride a bicycle. With time and practice, the activities outlined here will become more automatic. It's good to start by thinking about or discussing the 1 or 2 or maybe 3 indicators that capture the essence of a problem or an issue that you're trying to address. This brainstorming activity will help you to focus your thinking. Then, create a grid and label the axes. This is important. Time is on the horizontal dimension, and the indicators are on the vertical dimension. What are the units for time? What are the units for the problem issue? Once you've created a grid and labeled the axes, you can sketch a graph that reflects your understanding of the issue. It can be helpful to consider both a historical and a prospective component for the bot. You can do this on your own or in a group. In a group setting, I like to have individuals or subgroups create graphs on their own. Then it's possible to share and to compare. There's always learning when this happens. Finally, you'll learn a ton if you compare your sketch with available data and with the sketches from others. discrepancies among sketches and data indicate gaps in understanding. Let's work through an example. As the picture here suggests, opioid addiction is a huge problem in the United States. It's the largest drug epidemic in U.S. history. That's the current state of things, but it might be helpful to use a bot graph to help understand how we got to where we are. What we create and the ensuing discussion might help us to begin to think better about where we go from here. Using the checklist from a few slides back, I've gotten things started for us. Let's focus on the problem indicator of opioid overdose deaths. This isn't the only indicator we could focus on. For example, having a number of people addicted to opioids can lead to a tremendous burden on first responders in many communities, but it's an important one. I'm thinking about both prescription and illicit opioids, including heroin. We could have a good discussion about what to include or not to include. And I'm thinking about the U.S. as a whole. It would be perfectly okay, depending on what you're trying to achieve, to draw a more narrow geographic or political boundary around a state, a region, or a community. Again, we could have a great discussion around where to draw the boundary. I've read a few news articles and seen a few television segments that suggest that the problem of opioid addiction has developed over the past 15 years. So I'm somewhat arbitrarily using a time frame of 2002 to the present for my bot graph. If your interest was in periodic peaks in opioid-related overdose deaths over a longer time frame, you might consider a longer period, from, say, 1945 to present. Again, there's a great discussion involved in choosing a time frame, and the issues and processes that you would be considering would change as a result of changes in the time frame. So let's go ahead and sketch a graph. I'll go to the next slide to do so. You can sketch a graph on a piece of paper. Then we'll compare our graphs against historical data. Here's my graph. I'm starting out low on the graph, and the first thing I've discovered as I start to draw is that I don't know what deaths were in 2002. This would be a great thing to learn, wouldn't it? I've got a graph that's gradually growing and then accelerating. My sense, and it's just a sense based on my perception of the frequency of news articles in recent years, is that deaths have grown rather dramatically and in an accelerating fashion over the past 4 or 5 years. What did you suggest? What did you sketch? Let's compare that with some well-vetted data. Here's a graph that's using data from the CDC. The bars are showing total deaths from opioid drugs each year. The reddish line shows the portion of those deaths from males, and the yellow line shows deaths from females. Eyeballing the graph, deaths in 2002 were a bit above 12,000. I'll try to just mark that right there. Deaths in 2015, the last year for which data is available in this graph, are almost 35,000. That's roughly 3 times the population of the small city in which I live. Several questions emerged from comparing your graph against the data, and I've listed some that might be interesting to pursue. A critical question here is around the acceleration of deaths from 2013. Why did this happen? Is it an unintended outcome of some policy initiative? And how might we represent the structure leading to opioid addiction and subsequent deaths from overdoses? This is a real problem, a crisis that appears to have been years in the making. Is there leverage to reduce this problem? Over what time frame might we be able to influence change in the behavior of this system? Questions like these are good ones in the sense that they use behavior over time to help sharpen the focus of the inquiry. Additionally, as you practice thinking in systems, they can help you to begin thinking operationally. As I was looking at the data on the previous slide, in the back of my head, I was asking myself, how can I think about the different accumulations of people with respect to opioid addiction? What are the activities, the flows that fill and drain these accumulations? What are the processes or stages that are related to the increase in death? I was beginning to visualize in my mind's eye some simple maps that use stocks and flows. For me, main chains are the go-to structure for thinking in systems, for thinking in stocks and flows. They're simple, extensible stock flow structures that can provide a backbone or an organizing framework for the effort. We'll spend a few minutes up front talking about the basics of main chains. Then we'll walk through 4 variations on the main chain theme. These can be used in a very wide variety of circumstances, and I think you'll find them to be helpful in getting things going. What's a main chain? Well, while there's no universally agreed upon name for these structures, the idea behind a main chain is pretty straightforward. It's a collection of stocks that are connected together via flows. As a result, a main chain can account for the movement of people or things, aka stuff, among a set of different categories that are represented by the accumulations. So, a main chain can give you a high-level representation of a multi-stage process. The categories represented by stocks in a main chain are mutually exclusive and collectively exhaustive, MECE. In the generic example shown here, stuff is either in stock 1, stock 2, or stock 3. Flows move stuff between the different stocks. Unfortunately, the categorization of main chains is not quite as neat and tidy as one might hope. If the main chain theme is a collection of stocks that are connected via flows, there are 4 important variations on this theme that can be helpful for you to have in your back pocket. The first is an aging or a vintaging process. This can be important if, for example, there are differential issues associated with age cohorts within a population. The second is a development process. I tend to think of expansively about the idea of development, and there are many uses for main chains in this context. A third variation on the theme is related to the idea of a development process, but is perhaps more specific to health-related contexts. At a population level, main chains can be used very productively to consider disease progression dynamics, or what I like to call patient flow maps. Finally, and importantly, main chains are a great way to map the essence of supply lines. In a minute, we'll take a look at each variation on the theme. But before we do, let's think about a bit about the thinking behind the creation of a main chain. Here are a few guidelines that might be helpful for you, and I know they're helpful for me in my work. I like to begin by thinking about and asking about how the process works. This is important and perhaps a distinction from many other approaches. If you ask, for example, about all the factors that influence some issue area, you'll end up with a big pile of factors, and it can be difficult to structure them in any meaningful way. If you ask, on the other hand, how it works, you are often led toward a multi-stage process that you can represent using main chains. The main chain, then, can serve as a framework upon which you attach multiple factors in a more meaningful and organic way. I pretty much always work with a 2 or a 3 stock main chain at the outset of an effort. These are simple and they're powerful. They invite engagement as stakeholders add granularity or extend the boundary. But in a surprising number of instances, after the smoke is cleared, you'll end up with a simple 2 or 3 stock structure as your working map. Once I've got a simple map in place, I'll look to enrich the map via increased granularity, by adding flows into and out of the map from clouds, and other enhancements. I'll do this grudgingly, however. You're striving for simplicity, for essence. You don't want something that's simplistic and therefore not useful. But for many purposes, there can be huge value in a simple map that can organize and advance the thinking around an issue area. Okay, let's take a look at some main chain themes. Up first is an aging process. Here's a very simple map in which I've classified a population along the dimension of age. There are 3 stocks in this map. It's a great place to start. One stock represents children, say ages 0 to 18. The next stock represents young adults, let's say ages 18 to 35. And the last stock represents older adults, say ages 35 and up. At the left of the diagram, you see births, and deaths drain from each age group. If you were dealing with a region and it was important to consider migration dynamics, you also might consider migration flows of people into and out of each age group. This is a simple map, and it can be useful in considering issues in which age distribution of a population is an important driver of the issues under consideration. We can pretty easily extend the map to add granularity to the aging process. It simply takes additional stocks and flows to do so. The additional buckets in this map enable us to think perhaps a bit more precisely about things associated with the dynamic distribution of people based on their age. For example, how does the relative growth in a population of people over 70 relate over time to demand for senior citizen-related public health services? A map like we're showing here might support this discussion. It's important to note, though, that there's a slippery slope here. Increased detail in the map implies increased potential for a discussion to get into the weeds, dominated by detail complexity. There's a great quote from the artist Georgia O'Keeffe that's relevant here. She once said that details are confusing. It's only by selection, by elimination, by emphasis that we get at the real meaning of things. I really like that quote. If you kept adding detail to this map so that it had, say, 100 age buckets, one for each year, it might be very, very difficult to see the forest for the trees. A second variation on the main chain theme is the development process. As I mentioned here, I tend to view the word development in its broadest sense. Here we're looking at different stages relating to some aspect of development for individuals, for groups, for organizations, or even categories such as land. As with the aging chain, it's a good idea to start with just 2 or 3 stocks. You can always make it more complex later. Here's a simple example that captures a broad swath of issues. I've divided a population into 2 categories, non-users and users. These could relate to a product in a marketplace or perhaps to an emergent evidence-based treatment in health context. The adopting flow represents the movement of non-user to the user category over time. This little structure is at the heart of something called the Bass diffusion model, which is a hugely popular approach to understanding adoption processes. I recently did a Google search on this phrase, and I got over 16 million hits. So this suggests that the little 2-stock development structure can be used in a lot of different contexts. It's an easy extension to the simple 2-stock map that can make it much more interesting dynamically. Here, I've added a recycling flow. Practitioners can become adherent to a gold standard of care for some indication, perhaps through training courses or by learning from peers who do adhere to the gold standard. But over time, as the state of the art advances, and if practitioners don't keep current, their skills might become obsolete and they would fall back into the non-adherent bucket. When you're thinking about development processes, it's important to consider flows associated with what I call backsliding. Here's another example of a development process, and in this case, the development isn't really a good thing for society. The map, a 3-stock main chain, was something that I developed as part of a set of conversations around youth violence at the outset of the project. Participants in the conversation, as I recall there were about 8 of us around a table, spent the bulk of a 2-hour meeting discussing the drivers of youth violence in the context of urban neighborhoods. At some point in the second half of the meeting, I drew a map like the one shown here on a whiteboard. This map had 3 buckets representing neighborhood youth. Not involved, representing youth who are not involved in gang activities. Edge, representing those youth who are at risk of becoming gang members. And finally, gang, representing youth in the neighborhood who were affiliated with gangs. The diagram was drawn to capture the idea that it's easier to move towards the edge and into gangs than to move from gangs back to the edge and to uninvolved. This map formed a simple, one piece of paper framework that we used extensively to engage stakeholders throughout the project. It was a great conversation starter. In the process of engaging stakeholders, we were able to increase the level of granularity in the diagram and to support a rich set of discussions about how public services targeted different flows in the system. As shown here, we added multiple categories to the map, differentiating between development stages for gang members, as well as differentiating between different gang types. We extended the structure so that we could consider the dynamics around incarceration of youth. A third variation on the main chain theme, which is perhaps a little twist on the development idea, is the disease progression patient flow main chain. You may remember the basics of this from the first webinar, where we walked through a little exercise in which we mapped out the structure associated with an influenza epidemic. A good starting point for things that look like disease progression is the SIR structure. You can use a stock to represent the pool of individuals in a population as susceptibles, infecteds, and recovered. It's easy to add granularity to this sort of map, for example, to consider an intermediary pool of exposed individuals. And it may be useful to extend the boundary, as we did in the first webinar, by adding deaths and vaccinations and the like. In a similar way, you can use a 3-stock map to begin to represent patient flows associated with non-infectious chronic diseases such as hypertension. As shown here, one way to get at the patient flow is to divide the population into buckets of without hypertension, undiagnosed, and then finally diagnosed being treated. 3 stocks is not the only way to represent this sort of a main chain or this sort of a process, but it's a great opening move in my experience. If you wanted to add granularity to the mix, you could add stocks and flows. For hypertension, for example, it might be important to understand who is taking their medications. I'm told that high blood pressure medicine does no good for the patient unless they take it. This map extends the 3-stock opening move in a couple of ways. First, note the additional detail on the right side of the diagram, downstream of the diagnosing flow. It may be important to understand what portion of the population is treatment naive, that is, that has not initiated any treatment protocol after diagnosis. Second, note the addition of a dropout stock. This stock accumulates the flow of dropping out, and note that it decumulates the restarting flow. This underscores an important systems point. There is often more than one way to fill a bathtub. In this case, if we wanted to increase the pool of treated individuals, we could slow the dropout flow, or we could increase the restart flow. the policy initiatives aimed at these flows might look very different from one another. A final variation on the main chain theme, which we'll be talking about here, is the supply line. This looks a lot like other main chains, which is not surprising since it shares a simple 2 or 3 stock framework, but it functions a bit differently. The idea here is that stock represent inventories of stuff and flows capture the movement among those different inventories. As a result, the supply line can help you to add a little bit of a geographic aspect to your mapping and can help to address issues where bottlenecks seem to be at the essence of a problem. Late summer and early fall in the United States herald the height of hurricane season, and 2017 has been particularly devastating for some states and territories. While the immediate damage can be horrendous, follow-up relief efforts can be extremely challenging because of bottlenecks associated with damaged transportation infrastructure. Here's a little map that begins to look at hurricane supply chain dynamics. The map is composed of 3 stocks which reflect the location of relief supplies. The story begins with the arrival of supplies at staging areas that are external to the disaster area. From there, supplies are brought into the disaster area where they're stored in internal staging areas. And finally, supplies are distributed to their point of use where they're consumed. This is pretty straightforward, but what if there's a bottleneck? I've shown a simple extension to the map by using a little 2-stock main chain to reflect the loss and subsequent redevelopment of infrastructure. The connection from infrastructure to the arrival flow underscores the importance of infrastructure in getting supplies to where they're needed. If significant portions of infrastructure have been rendered non-functional by a hurricane, it will be essential to revive that infrastructure sufficiently to enable the movement of relief supplies to where they're needed. For an area in which infrastructure is weak to begin with, the implication is that relief efforts will be much more challenging than one might initially expect. This hurricane example is suggestive of an important point. It's possible to combine in various ways main chain themes in order to get at the essence of an issue. Sometimes, as with the hurricane example, the connection is via a connector or a wire. In other cases, the connection is a physical flow that distributes people or material among different stocks. One common combination in a public health context is to consider 2 dimensions, age and disease status. Both dimensions can be dynamic, and it's important to keep track of both so that you can get at the history dependence of that dynamic behavior. In developing 2-dimensional maps, I like to keep the idea of MISI, mutually exclusive, collectively exhaustive, in mind. This helps me to keep my thinking straight as I develop the main chain. Let's take a look at one example. Here's a real simple example motivated by some work I did several years ago. This map looks at the aging of people as well as the movement between smoking status for each age group. There are a lot of gears turning here, but I was able to use this little map along with some data about overall smoking prevalence and cessation rates for different age classes to develop an estimate of the rate of initiation of smoking for youth ages 12 to 18. A similar approach could be used to represent dynamics associated with the development of addiction to prescription opioids and the development of an illicit opioid dependence. This in turn could be used to estimate deaths by age band. Here's one more example of a 2-dimensional main chain. The context here is the use of evidence-based approaches to deal with mental health issues. For example, cognitive behavioral therapy approaches have demonstrated effectiveness in supporting individuals who have eating disorders. But such approaches can have challenges in practice. On one hand, for some groups, there may be a stigma associated with using mental health resources. On the other, Even if one does not perceive stigma, there may be accessibility challenges that result from inability to pay or difficulties in syncing up schedules with treatment providers. The map here depicts a population in 4 stocks arrayed along 2 dimensions. At the bottom of the map is the portion of the population that is unwilling to use evidence-based approaches. On the left is the portion without access, and on the right is the portion with access. The top of the map reflects access dynamics for those who are willing to use evidence-based treatment. This sort of a map can help one to think productively about policy. What is the distribution of individuals among the 4 boxes? What is the most effective policy set that can help people to move from bottom right or bottom left toward top right? And is the dynamic unidirectional, or are there flows that drive those at top right away from willingness and or accessibility? Okay, this has been a bit of a whirlwind tour. We've covered a lot of ground, and I've given a lot of examples. By way of summary, here are a few things that you may want to keep in mind as you seek to use simple main chains to get things going. Remember, think physically. Can you bucketize things simply? Start with 2 or 3 stocks. It's good to extend, but please keep it simple. And the final point would be, just as the longest journey begins with a single step, it's possible to develop some pretty sophisticated maps using these main chains as anchors. I thought it would be useful to cement some of these ideas by presenting a little caselet. This is based on some work done by a student several years ago, but I think it's very relevant in showing how the conversation starters can help to get things going. The context here is something called a rocket stove. These stoves have great potential to deal with an important systems problem in developing countries. To understand the potential of rocket stoves, it's important to understand the default stove that's used in many developing areas. The 3-stone approach that's shown here has been used for a long time, but it has potential problem areas that result from its inherent inefficiency. Among them, for areas with rapidly growing populations, extensive use of 3-stone cooking can lead to deforestation with all of the unintended consequences that come with that. The smoke from a 3-stone fire within a dwelling can lead to some serious respiratory problems. And finally, the burden can fall disproportionately on females. For example, if girls are out gathering fuel for fires, they aren't spending that time in school. Now, you might consider some of the long-term implications of this dynamic. Rocket stoves are one potential technological fix for the systems problem. Here's a picture of the stove. As you can see, it's really simple. Sticks and air go in the bottom, and heat comes out the top. Because of the design, rocket stoves are incredibly efficient, and they burn hot. They're easy to build, they're cheap, and they can even be built with local materials. They have great potential. The student project started out with great promise. Partnering with a local NGO, and you'd recognize their name, a student engineering group spent time in villages holding workshops teaching villagers how to construct rocket stoves. They ended the project thinking they had done a great job, and they had done a great job. Unfortunately, the outcome was less than desired. Villagers weren't using the stoves. The head of the student group was in my class, and for her final class project, she used the thinking and systems approach to conduct a postmortem on the experience. The postmortem could be framed as 3 essential questions. What happened? And how did this relate to what the student team wanted to achieve? What was the implicit mental model? What were the gaps in the thinking that led to this less than optimal result? And finally, If the student team had a do-over, how might they be able to improve the situation? Some of the conversation starters that I've outlined here help that postmortem process. Now, if you think about this issue, how might you characterize what happened relative to what they wanted to have happen? A bot graph could be really, really helpful. Why don't you take a minute and sketch out your thinking? While you're sketching, think about how you might have used this approach to help the student team come together around understanding dynamics. Here's a picture of some possible adoption strategies. I'm thinking that the process is likely to take on the order of 5 years to happen. And I'll draw 3 possible trajectories. The first is what I'll call the DOA trajectory, which was pretty close to what the student group saw. A second trajectory sees some use, but then a decline. Never quite getting off the dime. And a final trajectory shows growth and sustained use. That's the desirable one. Here's a picture of the apparent initial mental model, the student's initial working theory of how to make things happen. You can see 2 stocks in this map. Villagers move from non-owners to users through the process of building rocket stoves. This is a simple main chain, but probably too simple. By conflating stove construction with stove use, the student group missed out on some important stages of development. Here's a more detailed, more granular map. Note the addition of an intermediate stock to reflect those households that were trying out the new stove technology. And note the potential for dropouts, for giving up, and for re-engagement. The story of this map is a bit richer than the simple 2-stock map. After building stoves, households will try it out for a period. If it doesn't work because they don't like the food, for example, then they're likely to give up. And it's likely to be difficult to get former users to then re-engage. There are some potential positive feedbacks in this system. If we can support the development of expert users, then these exports might support the development of trial users into expert users, the re-engagement of former users, and the stove building activities of non-users. My student drew some interesting and I think useful conclusions from this postmortem. As I understand it, these have helped to inform subsequent student project work. I've listed them here, and while they may seem obvious, they weren't at all obvious to the student engineering group or to the NGO sponsors at the outset of the project. These lessons from the postmortem indicate how thinking in systems might help to advance the thinking around a systems issue. In particular, they suggest how the use of simple main chain maps can support richer thinking about how to make things work. Okay, let's wrap things up. You've seen this diagram multiple times, but it's helpful to keep the process in mind. This stuff is a process that supports more productive thinking and development of a more effective policy responses through the application of a practical skill set. Conversations that focus on behavior over time and on structure are great ways to apply the skill set. Today, I showed you some approaches that can get the conversation going. Behaviorally, the bot graph is a fantastic tool to use. Give it a try using the guidelines presented here. I'd love to hear how this goes for you. Structurally, we walked through several examples of main chains, including aging chains, development processes, patient flows, and supply lines. And I showed you a couple of examples that are suggestive of ways to combine different main chains to address multi-dimensional issues. There's a lot here, and to develop your skills, you'll want to practice. So in addition to the low-impact aerobics from the first workshop, you might want to come back to this webinar. It's being recorded to review some of the ideas presented here. I'll leave you with some practical advice. First, when you're facing a systems issue, seek to capture the issue as a behavior over time using one or more bot graphs. There's lots of value to be gained from this activity. Second, see if you can use main chains to capture system structure. Again, there's lots of potential value added by creating a system backbone. Finally, use feedback linkages, like we did in the rocket stove example, to represent the drivers of flow processors in the system. Okay, that's it. If you have any questions, please use the following contact information: healthpolicynews@cdc.gov. I greatly appreciate your engagement during the last hour, and I really look forward to interacting with you at our next session. Until then, take care.
Thank you very much, Steve. We appreciate your time, and we look forward to learning more in the next webinar.